Welcome back. Utah's health systems are teaming up to encourage everyone mask up. Joining us in studio to talk about this is Dr. Todd Vento with Intermountain Healthcare. Doctor, we're so glad you're here today. Let's start off with this collaborative effort. All of the medical professionals in the state of Utah making one simple request to the citizens.
Absolutely. Thank you so much for having me. And that's just what you said. We're joining forces, Utah Health Association, as well as the four largest healthcare organizations in the state, Intermountain, Steward, Mountain Star, and University of Utah, teaming up for what we feel is one of the most important things that we need to do right now as Utahns, and really across the country, is to encourage the use of masks by every citizen so that we can actually protect ourselves and protect others. And just to talk about how that came about in this past week and kicking off that campaign, which folks will see in the form of billboards and digital media, social media, et cetera, and these types of interviews, is that we have had obviously a rise in cases. We were 100 to 200 early on in the epidemic. Now we're 500 to 600. We've had increased hospitalizations, doubling of our hospitalizations, which is taxing our healthcare workers in multiple healthcare systems across the state, and we've had increased deaths. And we now know that masks actually make a difference, and we can talk about that in a second, but that's why we really encourage all Utahns to wear a mask. It's for yourself, it's for others, it's probably one of the most important things that can be done to stop the spread of COVID-19.
Okay, doctor, let's talk about, there was a bit of hit or miss messaging early on in this virus. Obviously, a lot of things have changed, a lot of things have been learned along the way, but there were some mixed messages on whether or not we needed to wear a mask, but now we know the mask can make a difference.
So glad you brought that up. It's so important. I will say that, we have a new virus. Think about this, December, we didn't know about this. 6 months later, it's around the entire globe. Everybody on the planet knows about it. We had time, it took time for medical scientists to learn about this. I will say, just like you said, misinformation up front. We don't think you need to wear a mask from WHO, CDC. Now, tons of studies. It stops spread of droplets from outside you and from others to you. It stops deaths in countries where mask use is higher and social norms actually support mask use. And now we know even from simulations that if we had a high rate of mask use in communities, we could actually cut down deaths by up to 40,000 in the United States by October. So the bottom line is, even if there's misinformation up front because people are learning about this brand new emerging virus, we do now know that masks make a difference, and it's really important that we now use that information and implement that so we can stop the spread of the virus now.
Okay, doctor, all this is so important, but a mask isn't necessarily about the individual, about myself for wearing it, but by wearing a mask, I'm helping protect those around me, my community, my loved ones, my neighbors, my friends, my family. So talk about that the mask really is not a personal thing, it's a community thing.
It's absolutely true, and I don't want to be sounding too cheesy, but tomorrow's the 4th of July. If you want to be patriotic to your countrymen and countrywomen, seriously, I was in the Army for 26 years, and I have a commitment to the public health of not only service members, but our community. And right now, one of the most important things you could do to celebrate, really, us being a team in this country and in our communities is to actually do something that will actually save lives. It is now known that we can stop cases, we can stop hospitalizations, and we can prevent deaths. And so a simple measure, in addition to the known effective preventive measures of social distancing, keeping 6 feet or staying at home when you can, washing your hands with soap and water, avoiding contact with others when you're sick, adding the mask to that in public can actually make a huge difference to preventing the death of someone else. Just think about that. If you can't think of it for any other reason, think about that. That data is solid now. We know that. So that's why we're here pushing this message to the entire state to try to get everybody on board to step up and mask up.
Okay, Dr. Vento, very simple but important message. I really love how you're driving that home with our upcoming holiday. We appreciate you being here. We appreciate all the work that you do for our community, and do want to remind anyone and everyone that intermountainhealthcare.org has so many resources and questions and answers you might have about COVID-19, all waiting for you right there. Okay, coming